Dr. Kourakin, we have heard a lot about, let's say, TMJ problems, which apparently cause headaches and migraines and shoulder pains and back pains. But there seem to be more ways to correct that TMJ problem, ways which haven't been previously explored and which are still extremely unknown. And all of those ways can be and should be actually administered by a dentist because it starts right in the mouth with the teeth. Tell us about it.
Helmut, I'm very frustrated sometimes by the medical community that they're not looking at the dental component of migraine headaches and TMJ headaches here. It's a shame that patients, out of frustration, and they've gone through the different physicians, the neurologists, the MDs, the pain guys, they finally say, because a friend might suggest to them, go see a dentist because he helped me. And when they come to us, they're literally at their wits' end. They're taking antidepressants, they're taking pain pills, they're not taking their medication there because they don't want to feel like a zombie, they don't want to be drugged, they need to work, they're working around machinery, they're dealing in casinos. These people need help, they need to function, and they need something that's going to work for them. And we have ways of assessing individuals there and being able to, in a very non-invasive way, provide them relief, sometimes 100% relief from migraines and headaches. And it's something that we strive each day, to incorporate into our lives, these kind of treatments here. I would not want to be uncomfortable. I want to alter my lifestyle. I want to be able to enjoy my lifestyle. And if it's something as simple as going to a dentist to help me, I'm going to do that.
Right. So tell me, Dr. Kourakin, more or less, I mean, I'm sure there's no bad formula and no real time you can tell me, but, what do most of the patients, how often do they need to come to you to see some results? We all have these problems, let's say, with chiropractors. Well, do I have to go 5 times, 1 times, 100 times? When can we see, when do most of your patients see some significant reduction of pain?
Helmut, we had one patient came in who was a severe migraine sufferer. We gave him one series of Botox injections. In a 2-week time period, we eliminated 75% of his migraines. He came back for another series of injections. We eliminated 95% of his migraines within a 3-week period of time. Only after 2 visits and a simple assessment. We didn't even incorporate an appliance for this gentleman there. Some patients, we place an appliance. It takes about 2 weeks to manufacture the appliance. Some will see results overnight. Others will see results, maybe, let's say, a significant improvement, but not a total improvement, within a week or two. When we do the combination of a muscle relaxer with an appliance and maybe physical therapy within a month's time. So we're only really looking at about 3 visits, maybe 4 visits.
Wow. And then the results come quite fast. So basically, because that's what most of us are worried. For instance, I think a lot of people don't take vitamins because, frankly, it takes years. Frankly, you only know when you get old that maybe what you did for the last 20 years is working. Yeah. So this is not like that.
Yeah.
This is.
Helmut,
go ahead.
I was going to say that if it's of dental origin, the treatment is going to happen quickly. And
Beautiful.
That's the key. The
Beautiful.
assessment has to be done, and it's got to be stated that this is definitely of dental origin. If it's of dental origin, you're going to get results there. If it's not of dental origin, then I'm sorry, I'll have to send you back to the neurologist and your pain meds and everybody else, because then you have to look at blood pressure or chocolate diet or whatever the case may be.
Got it. Dr. Kourakin, very, very interesting. If it's of dental origin, the fixing will take very little time. Days, weeks, or months, depends on how on what type of treatment is needed and how long it takes to make that, such as an appliance and etc. But once you have it, literally an immediate relief. Wonderful. Thank you very much.